Since 1990, the Washington County Mental Health Authority has been responsible for planning, developing, and monitoring mental health services in Washington County. They provide these services for the quality of life for the more than 5,000 elders, adults, children, and adolescents with mental illness. I would like to introduce to you Mr. Marshall Rock, better known as Rick.
My name is Rick Rock, and I'm the director of the Washington County Mental Health Authority, which is a core service agency for Washington County. Each county in Maryland has an office designated as a core service agency that oversees the public mental health services in each of those counties.
A few of the providers in Washington County include Brook Lane in North Village in Hagerstown, an outpatient office, Meredith Health of Hagerstown, an inpatient and outpatient location, and also Reach of Washington County in Hagerstown, a cold weather shelter with day resources and crisis services.
Our main client really is the providers in the community mental health system in Washington County. We have regulatory oversight to make sure that providers are licensed to be able to provide what they're doing and that they're providing services that are good and positive for the people that are identified as their consumers in their organizations.
The Washington County Mental Health Authority works directly with the providers, such as Brook Lane, because the Washington County Mental Health Association is not a direct service organization. On occasion, though, through their community consumer support funds, they are able to assist people with security deposits and first month's rent. At those times, the authority may have direct contact with clients.
We monitor that they are licensed appropriately for an outpatient mental health clinic, and that's making sure that they meet the state regulations for that. Maryland has an annotated code of regulations that providers have to apply to and adhere to meet the requirements for licensing through the Department of Health and Mental Hygiene. We participate in on-site inspections with the providers when Department of Health and Mental Hygiene representatives come out and monitor the quality of program and to make sure that they're meeting the standards that is expected. So we participate at that level.
If, when monitoring a provider, it is found that they are not quite up to speed with mandated requirements, the provider may be required to do a program improvement plan, get it approved, implemented, submitted to the Washington County Mental Health Authority for approval, who then sends it on to the state. At a future time, the Washington County Mental Health Authority would return to that provider to be sure they are adhering to the improvement plan.
There are 8 outpatient mental health clinics licensed through the state of Maryland in Washington County, and 5 of them are not-for-profit, private not-for-profit, and then 3 of them are private for-profit. There's also a clinic at the health department. Washington County Health Department has a substance abuse treatment program as well as a outpatient mental health clinic designation.
In addition to community oversight of the mental health providers, the Washington County Mental Health Authority receives grant dollars from the state. These funds are contracted throughout the community for services that are not traditionally funded by insurance, like outpatient services or individual groups. There is also a jail mental health program where a contracted provider sends social workers to the correctional facilities to screen and assess for mental illness. This allows for release coordination for services if needed.
We have a homeless outreach project that we fund here in the community to have people go out into the field, identify people who are homeless and maybe experiencing mental health issues, and try and get them engaged into treatment so that their mental health needs are being addressed.
Mr. Rock was able to tell me about several more programs which are in place in our community. I, as a fully functioning individual with a mental illness, was very impressed. To list a few, there is the Crisis Response Program, Shelter Plus Care, the Residential Rehabilitation Program, and the Psychiatric Rehabilitation Program, better known as PRPs. Unfortunately, time restraints will not allow Mr. Rock or I to describe these programs in detail. In conclusion, I find that the state of Maryland and Washington County have in place a very positive and productive outlook on the mental health of its citizens. The programs in place, overseen by the Washington County Mental Health Authority, appear to me to be very broad and take into consideration all ages and aspects of mental illness. As a resident of this state and of Washington County, I am very proud to have such programs in place and to have Mr. Rock and his staff overseeing them.